Good afternoon, everyone. I'm Eric Lufer, President of the Citizens Research Council of Michigan, and I'd like to welcome you to today's webinar on Michigan's Proposal 18-1, a statutory initiative to legalize marijuana. Michigan will have three statewide proposals on the November 6, 2018 ballot dealing with marijuana legalization, responsibility for drawing the maps for congressional and legislative districts after each census, and voting rights. In analyzing these ballot issues, we hope to provide information so voters can make better informed decisions in formulating their vote. The Citizens Research Council does not endorse candidates for office or take positions on ballot issues. Our analyses are available on the website. You can see the link there, crcmich.org/ballot-issues. All of our material is available at no cost. We hope that you will share these papers, the recording of this webinar, and any other material, our podcast. Share it with your friends and others, your coworkers, so they can be informed heading into the voting places. The Citizens Research Council of Michigan is a statewide nonpartisan public affairs research group. This is the Research Council's 102nd year of operation, a longevity we attribute to our promotion of sound public policy for state and local governments through accurate, independent, and objective research. We are a private, not-for-profit entity, and we rely on the charitable contributions of foundations, businesses, corporations, and individuals. I'd like to encourage all of you to join our circle of supporters and help us continue to provide high-quality, independent information on important policy topics in Michigan. You can learn more about the Research Council at crcmich.org. At the right of the website, you'll find an opportunity to sign up for our email distribution list so you can be notified about newly released papers and upcoming events. Our presenter today is Tim Mischling. Tim has been with us for a few years now, doing great work and research on health policy. His recent papers have focused on the Medicaid expansion program in Michigan. They call it Healthy Michigan, and public health funding and service delivery. Please note that we are recording this webinar and we'll post it on our webpage where it will be available for future viewing. Also, we have everyone but the presenters on mute, so we will not be able to hear you if you speak. There was an opportunity with registration to ask questions, and we have a few of those, but we welcome other questions, and you can type those in at any time in the dialog box associated with this webinar software, and then we'll pose those to Tim at the end of the session. If you have any technical problems during the webinar, please let us know by calling 734-542-8001. Also, after the webinar, you will receive an email soliciting your feedback, and we would very much appreciate any feedback you have. With that, let me turn this over to Tim, and we can get started.
Thank you, Eric. I guess it's high time that we look at this issue. Before getting into the specifics of the proposal, I want to take a little while just to look at the background of federal marijuana law. I think it's well known that marijuana remains illegal at the federal level even as states are changing their own laws. So early arguments for banning marijuana typically invoked anti-immigrant sentiments and also exaggerated harms related to marijuana. One of the key figures in this was a gentleman named Harry Anslinger, who served as the first commissioner of the Federal Bureau of Narcotics, which was formed in 1930 kind of as alcohol prohibition was going out the door. So perhaps seeking a new raison d'etre, Anslinger was instrumental in the passage of the Marijuana Tax Act of 1937 that effectively started the federal ban on marijuana. At the time, marijuana was linked to everything from violence and social degeneration to interracial sex crimes. This initial ban set the stage for the subsequent war on drugs waged by Presidents Nixon and Reagan. It's important to note that these federal policy decisions were not always aligned with expert recommendations. So, for instance, the LaGuardia Committee report, which was issued by the New York Academy of Medicine in 1944, concluded that marijuana was not a major factor in the commission of crimes, as was asserted by Anslinger and others. Later, the Shafer Commission, officially known as the National Commission on Marijuana and Drug Abuse, which was appointed by President Richard Nixon, concluded similarly that marijuana was not a major factor in the commission of crimes. In contrast to the policies advanced by Nixon, the reports actually by the Shaver Commission suggested that marijuana didn't pose a widespread threat, and that instead marijuana should be decriminalized, and that federal efforts should focus on treatment and prevention efforts. What's in a name? As a brief marijuana 101, we thought we'd delve into some terminology, and there are actually over 1,000 slang terms out there for marijuana. We probably don't need to know all of them, but a few that you should be aware of would be cannabis to start with, which is not a slang term. It's in fact the most generally accepted term for the plant that we're commonly calling marijuana. Cannabis refers to the genus of the flowering plant species that has up to 3 principal cannabis subspecies. So sativa and indica are the 2 most common that you see used in growing marijuana. Another important term is hemp. Hemp is a common name for the cannabis plant, and specifically, this English name is usually used for northern varieties of the plant that are grown for industrial uses as opposed to for the purposes of intoxication. When we talk about marijuana, we're often interested in its chemical constituents, and so you may hear discussion of cannabinoids. There are dozens of these, and the way they interact individually and together in a sort of entourage effect is still not completely well known. But the 2 probably most important that are typically discussed would be delta-9 tetrahydrocannabinol, commonly known as THC. And in the most basic terms, this is the chemical that makes people feel high or stoned. And then the other important cannabinoid to be aware of would be cannabidiol, CBD, which is used in medical marijuana typically. It's an important component that by itself doesn't cause one to get high and may actually limit the effects of THC. According to the World Health Organization, in humans, CBD exhibits no effects indicative of any abuse or dependence potential, and there's no evidence of public health related problems associated with the use of pure CBD. The last thing that we often get questions about is why marijuana is sometimes spelled with an H as opposed to a J, particularly in information communicated by the state. And this relates back to the Marijuana Tax Act of 1937. Prior to the 30s, typically people referred to cannabis, and this is still the technical term used in research, but marijuana was coined to make the drug sound a little more exotic. According to Martin A. Lee, stigmatizing marijuana use was a means for exacerbating anti-Mexican sentiment during the Great Depression, when many Anglos felt they were competing with brown-skinned migrants for scarce jobs. And so spelling the drug with an H made it easier to pronounce the unfamiliar word by anglicizing it. But to this day, you'll still see marijuana spelled with an H in federal and state law in Michigan. So now let's turn to what's actually in Proposal 1. So first of all, most obviously, it allows possession, use, and cultivation of marijuana. Specifically, it would allow Michigan residents that are at least 21 years of age and older to use, transport, or possess up to 2.5 ounces of marijuana, of which not more than 15 grams may be in the form of marijuana concentrate. Excess marijuana up to 10 ounces could be stored in a locked container within a person's place of residence, and people could also grow up to 12 plants provided that they're not in public view. Proposal 1 also creates a regulatory structure within the Michigan Department of Licensing and Regulatory Affairs, commonly called LARA. And this would include things like licensure for businesses, as well as various regulatory limits on things such as maximum THC concentration in marijuana. The proposal creates a new 10% excise tax that would be levied on marijuana sales, and this would be in addition to the state's existing 6% sales tax. Lastly, the proposal also eliminates most all criminal penalties for marijuana possession violations, such as exceeding possession limits or underage use, and replaces them with civil infractions that are punishable by fines. Tangentially, or sort of in a parallel manner, the proposal would also legalize industrial hemp. And as discussed earlier, hemp is typically grown for purposes other than intoxication, though it's the same cannabis plant. So typically this has a low concentration of THC and is used for things like textiles, papers, or food. There are a few things that the proposal doesn't do. It does not allow impaired driving by those intoxicated with marijuana. It doesn't allow the use of marijuana in public places. It also doesn't prevent municipalities from creating local marijuana ordinances. So cities could either completely ban or limit the number of marijuana establishments in their jurisdiction. It doesn't prevent businesses from enforcing their own marijuana policies in the workplace, and it also doesn't prevent property owners or managers from banning marijuana use on those properties. So in this case, we're thinking rental properties and landlords typically. So as mentioned, there's a new 10% excise tax, and an important question would be where those tax dollars go. First of all, they would go towards implementation, administration, and enforcement of the new law, and paying for LARA to set up this regulatory structure. There's also money set aside for clinical trials, specifically looking at the efficacy of medicinal uses of marijuana for various veterans' health issues. And so this is going to be $20 million for the first 2 years that's set aside for these FDA-approved trials. And finally, remaining funds each year would be distributed with 15% going to municipalities with marijuana businesses, 15% to counties with marijuana businesses, 35% to the school aid fund for use towards schools, and 35% to the Michigan Transportation Fund to help fund roads. In addition to the excise tax, as mentioned, there's also the Michigan 6% sales tax, and the sales tax would be allocated by its usual formula, which leaves around 70% of those funds going to schools. How much money is this going to raise for the state? Well, there are a couple different estimates floating around, and it's hard to predict exactly what revenue will be as it's dependent on a number of different factors. The Coalition to Regulate Marijuana Like Alcohol, which is the group that has initiated the ballot question, commissioned a study that estimated that adult use marijuana taxes will generate $53.7 million during the first year of operation and reach a peak of around $134 million per year in fiscal year 2023, which is when they estimate the market will reach maturity. It's important to note that medical marijuana revenue is expected to decline slightly, and that's judging by other states' experiences where legalization of adult use recreational marijuana has caused medical marijuana sales to decline. Another analysis released yesterday by the Senate Fiscal Agency is a little bit rosier in its projections, almost double. So it's estimated that $100 million would be raised in revenue during the first year, and then $288 million in fiscal year 2023. Senate Fiscal Agency estimates also predict a reduction in revenue from medical marijuana. To put things in context, of just how much money this would be, it's often alleged that the lottery has failed to do its job by paying for schools. And when you look at lottery funds, after prizes, operations, and retail commissions, 100% of those surplus lottery funds are directed at schools, and this totaled $924 million in 2017. But this still only accounted for a small fraction of the school aid fund. And even when you look at transportation, with billions of dollars of needs, what marijuana would generate is really going to be a drop in the bucket. As mentioned previously, marijuana remains illegal at the federal level, but states have begun taking action on marijuana issues in past decades. This began in 1973 when Oregon moved to decriminalize marijuana, creating fines as opposed to criminal penalties for marijuana use and possession. In 1996, California became the first state to legalize medical marijuana. Michigan followed suit in 2008. And in 2012, Colorado and Washington became the first states to legalize recreational adult use of marijuana. Today, most states have at least some CBD or medical marijuana law on the books, and 9 states, as well as Washington, D.C., have legalized recreational adult use of marijuana. Other states, in addition to Michigan, are also considering ballot questions this year, including legalization in North Dakota and medical marijuana questions in both Missouri and Utah. So let's look at a few important issues to consider as voters are making up their mind on how to vote on Proposal 1. First of all, there's been an immense human cost to the criminalization of marijuana. It's estimated that in 2015, there were 570,640 arrests for marijuana nationally, and this far outstrips the number of arrests for all violent crime combined. And in Michigan, that discrepancy is even greater. We also see a variety of racial and socioeconomic disparities in arrest rates, with Black adults being more than 3 times as likely to be arrested as white adults despite similar rates of usage. Criminal records for drug possession create a variety of social and economic barriers, making it more difficult for individuals to find employment and creating social pressures. That being said, there are comparatively few individuals that are incarcerated long-term for simple marijuana possession. One estimate of the price of marijuana criminalization suggests that when you look at arrests and prosecution, probation, and incarceration, expenditures in Michigan may exceed $347 million each year. So this comes at a high cost. Another important point of consideration is whether the money being raised by marijuana legalization would be used wisely. So since other states have legalized, we have a few points of comparison. And when we look at the other states that have legalized marijuana, we see that they have comparatively higher tax rates, including 37% in Washington and now 30% in Colorado. And that's reflecting a raise in taxes from when marijuana was first legalized in that state. The majority of these states also invest a significant portion of marijuana taxes for functions like substance abuse treatment and prevention, mental health services, health education, data collection, and a variety of other public health functions. And as a point of comparison, more than 60% of the revenue in Washington goes to health-related expenditures, a portion of that going to the state's Medicaid program, but also health education, public health, mental health. And funds in other states have also been invested in youth drug education, school dropout prevention, and criminal recidivism reduction. So the idea here is that in general, when we think of excise taxes or sin taxes or any kind of fees, is that an activity should pay for the costs it creates. And in the case of sin taxes, it should also, to an extent, disincentivize the behavior by raising the cost of engaging in that behavior. We can see examples of this with, our expectation of motor vehicle registration or fuel sales or road tolls. We expect those dollars to fund transportation, even if the truth in Michigan gets a little murkier. When we look at the lottery, some money is used to address problem gaming. When we look at tobacco revenue, some of those funds are used to address the health consequences related to smoking. And in Proposal 1, we're not seeing this with marijuana. Admittedly, there are still factors of marijuana legislation that aren't legalization that aren't clear, but we're not setting ourselves up to collect data either or track the consequences of the proposal. We're not putting any money aside for substance abuse treatment or prevention, mental health services, or public health functions that we know will be needed, at least to some extent. And so in many ways, that's the definition of leaving ourselves unprepared to deal with any unintended consequences if this ballot initiative is approved by voters. There are some risks of legalization. So marijuana legalization, I think when we look back to the Schaefer report, really it can be viewed as a public health issue. And it's important to note that occasional use by healthy adults with no particular risk factors is probably not a cause for concern. And one could argue that safer products and labeling might be seen as a public health improvement. If people are using marijuana already, having the marijuana that they obtain be free of any adulterants is in a way good for their health. There's also some preliminary research that suggests that marijuana may be used as a substitute for dangerous opioid pain medication, which is of particular interest amidst what's being called an opioid epidemic. But it's important also to realize that health is a multidimensional construct. And so when you consider a person's health, it's their physical health, but also their mental health and their social well-being. And there are a number of negative outcomes associated with frequent and heavy use of marijuana, especially when that starts early in a person's life. So smoking marijuana on a regular basis is associated with more frequent chronic bronchitis episodes and worse respiratory symptoms. Marijuana use is likely to increase the risk of developing schizophrenia, other psychoses, social anxiety disorders, and to a lesser extent, depression. And there's, obvious links to cognitive impairment. There's a link between marijuana use and the development of substance dependence and or substance abuse disorders, not only for marijuana, but for other substances, including alcohol, tobacco, and other illicit drugs. Abuse and dependence is a particular concern. It was long believed that marijuana was not addictive. More recent, higher quality evidence shows that that's not the case. And around 1 in 10 marijuana users do form some sort of addiction or dependence. We see that from 2002 to 2013, marijuana use among adults has more than doubled and continues to grow. And the number of people with a marijuana use disorder also doubled during this time. And around 3 in 10 users manifest some sort of marijuana use disorder. So this could mean using more frequently than a person wants, or using a higher quantity of marijuana than the person desires. And it's a particular concern, both because the perception of marijuana's harm is very low, and so qualitative evidence shows us that people often don't seek treatment of their own volition because they don't realize that marijuana can manifest a use disorder. And it also can lead to social and economic consequences based on how much people are spending in terms of their resources to obtain marijuana, and how much of their time is spent in a state of intoxication. And so when we look at research evidence, many people report lower satisfaction in jobs and in relationships related to marijuana use disorders. The experience of marijuana dependence may be less severe than what we see with other substances, so a good example there would be opiates, but it's also more similar than different, and marijuana users who form dependence can still experience withdrawal symptoms when they try to reduce their consumption. Underage use is another particular concern, particularly because the early use of marijuana is associated with more severe consequences than initiating marijuana use later in life. Adolescent use leads to as much as 7 times greater the odds of developing a marijuana use disorder. And this seems to be that the greatest risk is around age 15, but even people into their early 20s have greater odds of negative consequence than people later in adulthood. Adolescent initiation of marijuana use may also lead to some primitive cognitive impairments and neuropsychological decline. The research on this is still developing, and we need a better understanding of the full effect. And the risk of substance abuse and dependence and concurrent and lasting effects on cognitive functioning in adolescence actually appear to be greater for marijuana than they are for alcohol. Another important public health risk associated with marijuana is impaired driving. Use of marijuana before driving increases the risk of a fatal collision. Admittedly, alcohol creates a greater risk of fatal collision, but when used in combination, marijuana and alcohol create a synergistic effect where the risk is far in excess of the additive effects of either substance alone. The proportional role of marijuana, or other drugs for that matter, in impaired driving is kind of obfuscated by alcohol. We currently have inadequate technology to do accurate roadside drug tests, and so when someone is found with alcohol in their system, that's usually enough for an arrest to be made. And so further investigation into the proportional effect of various drugs like marijuana is difficult to assess. So let's look at some conclusions that we can draw. It's easy to look at Proposal 1 and intuit that marijuana legalization is a binary decision. Either you're in favor of legalization, or if you vote no, you're in favor of the status quo, because a no vote essentially leaves us with the status quo. But this blurs the nuance that typically goes into policy. And so one distinction one might make is the difference between decriminalization, which would be removing all of the criminal penalties associated with marijuana use and possession, and legalization. So when we're looking at decriminalization, we have some good examples at the state and local level, as well as internationally in places like Portugal that decriminalized all drug use in 2001. And we see that this allowed a divertment of resources in the criminal justice system to then be used for treatment and prevention. By contrast, legalization includes the other things we're talking about, which is a regulatory structure for marijuana to be sold, as well as the tax structure that we have. We could also consider legalization without a regulated market, and this is what happened in Vermont. Vermont is unique in a couple ways. It's the only state that passed legalization of marijuana through the regular legislative process, as opposed to doing it by ballot initiative. And it did so without creating a market for sale or tax structure. There's also the idea that we could legalize things by legislation through the normal process in Michigan. And we see right now bills addressing industrial hemp, as well as bills addressing the forgiveness of past marijuana violations. And so the public pressure that is behind putting a ballot question up for consideration, it translates into legislative action over time, and we're seeing some of that. Whereas passing a ballot question as it stands, it's harder to change later, requiring a legislative supermajority. Often ballot questions that are approved by voters need later legislative modification or fixes. We've seen this in other states that have legalized marijuana, and that creates a fairly high hurdle in Michigan. So in conclusion, supporters of Proposal 1 might value individual liberty or personal choice, and that could lead them to support this. They could want to end the criminalization of marijuana immediately by any means available and see this as the best way of doing so. They could see a legal market as a way to regulate and capture revenue from activities that already occur illicitly. Or they may just enjoy using marijuana and want it legalized. Opponents might look at Prop 1 and oppose the normalization of marijuana use associated with state-level legalization. And we do see a proportional reduction in the perception of harm and the social stigma around marijuana use in tandem with changes in law. They may want to end criminalization of marijuana, but they might want to do so through decriminalization without creating a new legal market. They may fear the rise of corporate marijuana interests, like a big marijuana akin to big tobacco that looks to profit from substance abuse and dependence. Or they may worry about the lack of funding in Proposal 1 for public health and data collection. These are public health and mental health systems in Michigan are two of the worst funded areas of state government. And so while roads and schools certainly need money, so does public health, and this would create costs without providing any funding to address those costs. And with that, I'm happy to take some questions.
Thanks, Tim. So we have a few questions that have come in, but there is still time if there are things that you want to know about that Tim didn't address, please type them into the question section on the webinar software, and I'll relay those to Tim. So one question we've received has to do with the finances of this. You talked a little bit that there may be some cost savings with not arresting and prosecuting for possession, but there are some other costs. Would you talk a little bit more about that?
Sure. So there are a variety of different models for estimating the cost of drug criminalization and marijuana specifically, and we offered one of those estimates. So legalization, it's possible that it would create some savings in the realm of arrests, but when you look at arrests or prosecution as proportional activities, we can assign a cost to that, but it may not be realistic to believe that making marijuana legal will lead to municipalities laying off police officers or a reduction in prosecutors and others involved. And so while there's a proportional cost, we may not see that reduction at the local level. In terms of probation or long-term incarceration, it's possible to see some savings in corrections, for instance. But as I mentioned, well, there are a large number of marijuana arrests in Michigan. Few people go to prison long-term for just simple possession or use of marijuana. There are often a variety of other charges there. So it's hard to say exactly how much would be saved, and we could expect some other costs. So there could be costs associated with impaired driving enforcement. There could be a shift to property crime. There could be costs associated with the new regulated market and related rules. And so it's hard to project those things without predicting behavior, and behavior is fairly unpredictable.
So question would like you to discuss how this got on the ballot, and I think related to that, you touched a little bit, if it is passed, again, reiterating what it takes to amend this, and if you're aware of anything that's in the legislature related to marijuana legalization, to evolution of medical marijuana, anything along those lines.
Yeah, so in the most simple terms, getting on the ballot obviously requires putting together a question and collecting signatures. And so this was put on the ballot in the same process as other questions that we see. I'm not sure I totally understand what's being asked. And in terms of legislation, as I mentioned, there's a current bill that would forgive past marijuana violations. There's industrial hemp legislation. We've seen an evolution in medical marijuana since it was passed in 2008. There was some initial trouble, and that regulatory structure seems to finally be established, and that took some action on the part of the legislature.
So a question about testing for marijuana use. We know if there's somebody pulled over for alcohol or somebody drunk in public spaces, they're able to use a breathalyzer. How will the police know if somebody is high on marijuana?
Well, as I mentioned, there's not a good roadside test option. Canada is, legalizing marijuana across the entire country with some differences in each province. And the expected tool to be used there is something called the Draeger drug test 5000. And so that's a means of testing oral fluid samples for drugs of abuse. So not only marijuana, but also opiates, cocaine, methadone, amphetamines. And it offers an option for a easily administered roadside test, but problematically, there are still fairly high rates of both false positives and false negatives. So it may allow someone to be subsequently tested for drugs through a blood test. But it doesn't give a really clear indication. The other issue is that heavy users of marijuana may have the cannabis remain in their system for a number of weeks, and so it may be that you would find cannabis in someone's system even if they weren't impaired at the time that they were driving. So it really does create a substantial challenge for law enforcement to address that issue, and it's a serious concern. As I said, marijuana use will increase the risk of fatal collisions, and especially when used in combination with alcohol, which is often the case.
We have some questions about those proposing this and those opposing. Do we know sort of who's behind this? Is it outside interest? Is there what sort of money is going into this? And on the flip side, I'm not even aware that there's organized opposition, but certainly the business community is worried about their ability to attract workers that can pass a drug test. And so some of the chambers of commerce have expressed some concerns about this, but that's the crux of the question. What do we know about those for and against this?
Sure. So I don't have the entire financial lists in front of me, but within the coalition to regulate marijuana like alcohol, which would be among the supporters. On the one hand, you have groups like the ACLU that are concerned with individual liberties or social justice issues. You have, we've seen over the last couple decades some organized interests in favor of legalizing marijuana at the national level, like NORML, for instance. And then we also, when you trace the money, you see that there's some investment from tobacco shops, for instance, who obviously would have a financial stake in profiting in a similar business model with a new alternative product. So that's what we see on the support side. On the opposition, there's some organized opposition. Most of that funding has come from a group called Smart Approaches to Marijuana, which is made up of mostly public health, drug policy, and medical individuals that are concerned about the potential public health impacts of marijuana. And we've also seen opposition not only from the public health and medical communities, but also from the usual suspects, so your law enforcement, your prosecutors as a whole. And obviously there's individual level variation with all of these groups, as well as the business community has expressed some opposition.
Do we know anything about how the alcohol industry is reacting to this? Is there opposition from them, or are they playing any part in promoting this?
I haven't heard any opposition from the alcohol industry, and I also haven't seen any active promotion. So it may be the case that, but if it's happening behind the scenes, it's not something that I'm aware of.
Well, let's talk a little bit about the roles that local governments play, especially vis-a-vis the medical marijuana. With medical marijuana, everyone's presumed to be out unless they passed an ordinance to allow dispensaries, and the opposite is here. How do we see that playing out and sort of across the different regions of the state? Do we think this is going to flourish in all places?
So some survey data from local governments that was collected and released from the University of Michigan showed that a majority of local government officials oppose marijuana legalization. And we've seen similar things in other states where there are some local governments that opt out, and what tends to happen is that there are some large urban centers that will have a large concentration of dispensaries, and that was sort of observed in Michigan with medical marijuana as well. And then rural outlying areas that don't really have any legal marijuana outlet. And so that creates a few concerns. It's obviously, if you're a supporter and you want people to have access to legal marijuana, it could be problematic if they have to drive 2 or 3 hours to the closest place to buy it, and that could also incentivize a continuation of the black market in those areas. It also creates an issue of kind of local government sovereignty, because just because a local government bans a marijuana business from opening up, it doesn't mean that someone can't go to the next city over and purchase marijuana and bring it back. And so the boundaries become a bit arbitrary, and for those local governments that, whether through pressure from residents or from the local government's decision-making opt out, they're also cut out of any potential revenue that would come from marijuana legalization, but they would still face many of the same associated social and fiscal costs.
Another question related to medical marijuana versus this proposal, the regulatory side. We've had some conversations with Lara and their thoughts on regulating this. How much synergies are there between medical marijuana and this proposal, and are there conflicts? Are there things that will have to be worked out on the regulatory side to manage one versus the other?
Yeah, that's a really good question. From my sense from discussing this with folks at Lara is that they've hit a lot of the initial hurdles in setting up medical marijuana, and so having learned from those experiences, that would facilitate this process going a little more quickly. There are a lot of outstanding regulatory issues, so the proposal leaves a lot of things vague in terms of, maximum THC concentration that's allowed, in terms of limits on advertising or preventing advertising to kids. So there are a lot of decisions that Lara would need to make. And in terms of differences, there are some key differences with medical marijuana. Well, with recreational, it would be limited to adults that are 21 years or older, and with medical marijuana, individuals younger than that could theoretically obtain medical marijuana if they had the right approval from their guardian and from physicians, and so there are some differences on either side, but it's not my sense that it would create huge administrative hurdles or burdens. The one thing that I would note, as mentioned in the presentation, is that it's expected that medical marijuana consumption would decrease in parallel with legalizing the adult recreational use. And I have heard some concerns that sort of specialty strains of medical marijuana that are designed specifically for certain conditions, or marijuana that's higher in CBD content and lower in THC content may not be as viable on a large scale market, and so you may see some reduced production or require a specialty boutique type setting for specific strains of marijuana designed for medical application.
So I think this was the last question, unless somebody sneaks another one in real quick. You mentioned that this is, well, let's take this other one that just came in. Talk about smoking is certainly the way of ingesting marijuana that we're most familiar with, but there is an evolving market in edibles and other. How will those be treated? What are those types of applications, and how will those be treated under the proposal?
Yeah, that's a good question. Smoking is still the most common means of consuming marijuana, but there are, as was stated, a variety of other methods. Kind of the traditional is, you would think of edibles, and typically that would involve reducing the marijuana flowers in some sort of fat or lipid, so like butter, and then using that to bake the quintessential marijuana brownies. But we also see a variety of edible products like gummy candies and things like that. So those are all legalized under Proposal 1, or would be. There's also, what's called a dab, which is a high concentration of marijuana, and so that allows a person to burn and inhale a small and quick dose of really high concentrated THC. One concern we've seen in other states is that these more concentrated dose methods, or with edibles, where it takes longer for the drug to take effect, that people tend to overconsume and then have some adverse health reactions, including, anxiety and respiratory distress, people vomiting and screaming, showing up to emergency rooms, and after legalization, poison control calls and hospital emergency room visits for related to a variety of marijuana products have gone up in other states. And so I think it's not kind of grandma and grandpa or mom and dad's marijuana from Woodstock. It's a whole new variety of products.
That's a nice segue to another question that's just come in. Can we talk about the experience in other states? Are there lessons that we could learn that we should be sharing with our policymakers, specifically as it relates to the use by youth, underage use? So is there indication that uh, more teens, people who wouldn't be covered this, but they're finding it more available, is that increasing in other states?
So the biggest lesson I would take from other states is what I've already stated, that not only is there a higher tax rate, but those funds are invested in ways that address some of the potential problems that could be associated with marijuana. And so specifically looking at, underage and youth use, Colorado is sort of the first state that came out. What we've seen is that use among kind of high school aged and middle school aged children in Colorado has not increased. It's held relatively stable. Although when we say that, it's also important to note that Colorado sort of leads the nation in terms of underage use, and some people you have to look at when you're talking about use. It's important to look at a variety of factors. So kind of the secular trend, ongoing trends of, is use going up or down overall? You have to look at social norms, modeled behaviors that people are seeing, legal behaviors, and you have to look at consumption in terms of both not only the number of people that are consuming the substance, but also the volume that's being consumed. And so while the number of youth in Colorado didn't go up, there's some evidence based on, like I said, the emergency room visits as well as the perceived harm from the drug, that there's less perception of risk associated with it, and that people may be using greater quantities or using higher concentrated products in Colorado. In contrast, when you look at Washington, an initial survey that the state did didn't show any increase in underage use, but then a subsequent, I think, more robust study published in JAMA Pediatrics, that's the Journal of the American Medical Association, found that there was a small increase in underage use. And when we're talking about adolescence, it's important to look at late adolescence as well. And so kind of our post-high school 18 to 22 group, that's where we see the highest volume of use. And there's still a high potential for harm in that age group. One of the lessons I would take from other states in addressing this is that there's been substantial investment in drug prevention in schools. And so that type of education may create a countervailing pressure that disincentivizes use. It's also certainly dependent on family structure. And so it may be that what we're seeing is that people before they turn 18 have a lot of social control exerted by parents, other family members, guardians, or school officials, but then that use is increasing substantially when they turn 18 because the perceived harm of marijuana use has decreased so precipitously. And so if Michigan doesn't set itself up to address those issues, I think that could be a serious problem.
Our paper discusses the potential rise of big marijuana, akin to big tobacco. Has there been a development of big marijuana in any way? And if so, are there corporate names that our listeners should be aware of as they hear this discussed?
I'm not aware of any publicly visible corporate names in marijuana, but a couple of things to look at that may indicate this, at least in the way the business model is set up, is that if you look at the states that legalized early, and we use those as examples because really we have a few years of data now from Colorado and Washington, and that's not enough to project long-term trends. Often things change dramatically over time and may do so in a nonlinear fashion. But using those as the best examples, what we see is that the vast majority of profit in terms of selling marijuana comes from a very small number of users that are using marijuana every day or almost every day, and so that makes up a proportion, proportionally, around a quarter. I don't have the exact numbers in front of me, I apologize. It's around a quarter of users that are using very heavily, and that's the vast majority of profit. And then your occasional users on the other side of the spectrum don't generate very much money. And so when we think that 3 out of 10 people who are using marijuana have some sort of marijuana use disorder, that's where as much as 90% of the profit from marijuana sales are coming from those individuals. And so even with advertising controls, there's a definite profit motive to exploit that use disorder and encourage a heavier volume of consumption, not only marketing to new users. So we see that in other states. What we've also seen in states like Oregon is that when there's no limit on the number of licenses that can be issued for marijuana businesses, and Prop 1 in Michigan would also explicitly prevent LARA from limiting the number of licenses offered to marijuana retailers. And so in Oregon, marijuana production has tremendously outpaced public demand, particularly because a person can only smoke so much marijuana, but there are also possession limits in the law. And so what is inferred is that excess production is then intended for transportation and illicit sale in other neighboring states, such as Idaho, for instance, that do not have a legal marijuana market.
So we're going to make this the last question. As you mentioned, marijuana is still illegal under federal law, a Schedule 1 narcotic. What does that mean for the consumer? Will they be able to use credit cards or debit cards to purchase marijuana? And on the distributor side, are the distributors, people getting into the business, are they be able to use the banking industry? Are there other issues like that we should be thinking about as we go forward? And if you know anything, is there any thought at the federal level about changing the status as a Schedule 1 narcotic?
So in general, so to answer that, there's a couple parts to that question. So marijuana businesses operate as cash-only businesses, and they don't have access to banking services. And so and that's related specifically to the federal ban on marijuana. And so that creates a number of risks. It can create security and crime concerns to have large volumes of cash being stored at business locations and then having to be transported to the state capital, which obviously it also creates some interesting challenges for tax collection that other states have had to deal with. In terms of changes at the federal level, I haven't heard any indication by the current administration of an interest in changing federal policies related to marijuana. For its Schedule 1 classification, that means a drug with a high potential for abuse and no accepted medical application. So it's kind of, you can look at Schedule 1 as being non-medicine, and then all the, Schedule 2 through 5 of being medicines that are, varying degrees of risk. It's from a very technical standpoint, it's still an accurate definition, because while the FDA has approved a couple drugs that use chemicals derived from cannabis, marijuana itself, in terms of smoking a joint where you can't control the dose, that's still not an accepted medicine. And so I haven't heard any indication at the federal level of changing federal rules or laws. That being said, the more states that take action, whether that's some form of legalization, whether that's medical marijuana, whether that's a decriminalization or any other state actions. Over time, we've seen with other issues that sometimes states take the lead and are the laboratories of democracy experience, generating experience with different approaches to an issue that at some point the federal government would have to look at what states are doing and assess its policies.
So with that, we're going to wrap up. Thank you all for your time and the great set of questions. That was a really good conversation, I think, at the end. If you have any other questions, you can send them in. Tim's email address is tmichling@crcmich.org. This is the first of 3 webinars. We're having a webinar for Proposal 2 tomorrow. Same bat time, same bat channel, 1 o'clock. You can register for that on our website if you haven't already. And then Thursday at 1, we'll be dealing with Proposal 3. Thank you all for your time and attention, and have a nice end of the day.